Welcome to the I AMU podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Hey everyone, welcome to the I AMU podcast. Today I'm excited to have Deb here with us today. Deb, thank you.
Hi, thank you for having me.
Accepting the invitation to come here today.
Thank you.
And thank you for being courageous enough to come here and share your story.
Thanks.
As we were just discussing, the stories that our women are sharing in this podcast are very valuable, mostly to empower our women to become their own advocates and speak up. So why don't we dive in on your story? There's a reason why you're here. And I want to start saying, in the healthcare journey, so many times we come across people that they stand up for you and they are your healthcare advocates, people that you trust that they have your best interests at hand. Has that always been true for you?
No. I grew up with the idea, with the belief that your primary care doctor was in a godlike position. And by the time I was 18, I realized that that's not true.
So, I'm sorry. I know that you have so many things that you want to share, but when you say godlike position, that sounds like it's like an authoritarian person, somebody that tells you things and you got to abide by that.
Okay.
Is that what it means?
That's, yeah.
What does that mean to you?
Oh, to me right now, that doesn't apply to my life, but that's how I was raised with my mom and my aunts, where their primary care doctor was equal to God. And this man said, do this, you did this. And he said, you don't take it, you don't take it.
Even if you knew inside your heart that this was not necessarily right. They
Yes.
took it as a word of God.
Yes.
Okay.
I mean, that's how he affected their lives.
So why 18? When I turned 18, I said no.
I had a lump under my arm, and my mom was in a hospital, so I went to the doctor. I went to him on my way to visit her. And I sat on the table. He looked at me and he said, "You're just turning into your mother. She's a hypochondriac and you're turning into her." He didn't look at my arm. He didn't palpate it. He didn't do anything. He just said that and walked out of the room.
Which is the unfortunate truth for many women that go through the journey where they are told that there's nothing wrong with them, or they're made believe that whatever their experience is on their head. Luckily, in your case, it was something that was obvious. No, it was not a symptom that sometimes it's symptoms that people cannot show. In your case, there was a lump. No?
Mm-hmm. Yeah.
So what happened after he told you, oh, you just turned into your mother, you're just a hypochondriac? What happened then?
I stopped at my mother-in-law's house, and I showed her, and I told her. She said, no. She said, you're going to my doctor. She called the doctor. I got in the next morning at 8 o'clock. And
that doctor, what was the difference between that doctor and the first doctor that you were used to see?
He listened. First of all, he listened. Secondly, he looked at it. He felt it. And then he gave me 1 or 2 medications, told me to apply heat, told me that if I wasn't better in 3 days to call him. But he just listened.
What a difference in the two of them. No, like sometimes we think that it's necessary sometimes it's not even the knowledge, it's just the caring. It's like, I'm just listen to what I have to say.
Exactly.
And then that will facilitate in the healthcare relationship is a partnership, no?
Yes.
And that's what you meant with, it was this godlike situation where what I said is correct and then you just have to leave my office, even if you feel empty with that answer.
Yes.
Got it. So you experienced at firsthand from the beginning a system that sometimes failed to be there for you, but at the same time, contrast, you did found a provider that listened to you, and that makes a big difference. So if you were to help our listeners today, just with the beginning of your story, is I think that one of the most important aspect of this initial part of your story is I spoke up, my doctor didn't listen to me, made me feel that I wasn't important, but I didn't stop talking. I shared with somebody else, and then finally somebody did listen to me, and I was taken care of.
Yes.
Emphasizing the importance of seeking until you find an answer. Because it's part of what we're trying to have our listeners today understand, that so many times you're going to come across those physicians that feel that they have the ultimate word and they don't allow you to speak up and talk about your symptoms. Has that been repeated in your life? Was that the only event, and then ever since then, all the doctors will always listen to you?
No, they. The next time it occurred was whenever I became pregnant, and
oh yeah, you got to tell us that story. Tell us that story. What was happening in your womb with that baby? When you were questioning?
There was two of them in there, and they were kicking around and just doing all kinds of little antics and everything. And I would try to sit, and I couldn't sit. So I questioned them like 2 or 3 times, like, are you sure it's just like one baby? And the one just got really angry. He said, you've had miscarriages before. You think you know everything. You're having one long, large, normal, healthy baby. Closed the chart and walked out of the room. And I'm like, okay, well, you better stop thinking like that because, again, he says, a long, large, normal, healthy baby. I delivered twin boys on my husband's birthday.
That is amazing, yeah. No? So, again, one more thing. Who knows the body better than the one that is living in that body? No? So you were feeling 2 babies in your womb. Mm-hmm. And you're saying, are you sure this is just a baby? Because it's like super active. And then they still insist that it's a baby. It's one child. And we don't have to look for another baby because I'm saying it's one child. And you don't necessarily know. Which, let me tell you, I'm pretty sure I wish I was there to watch their face of surprise when this. Well,
yeah, in the delivery, the one came, and I guess it's a birthing process defect, but the other one was born 19 seconds later, a breech. And if it wasn't for the gynecologist looking, I mean, he put his hand down just as my son was ready to hit the floor. I mean, that's how close it was, and that's how they weren't expecting it at all.
It was not a surprise to you because you knew there was going to be 2 babies. It was a surprise to them. Yeah. And then sometimes is being too arrogant can be bad, no? But being arrogant in general, period. No, it's like, why would you not listen? Like, why would you not listen and think that you have the ultimate word? In this case, luckily your kids were born and they were healthy. Mm-hmm. Yeah? Yeah. So, fast forward, your journey with your in your cardiovascular world. Talk to me about that. How does that end up happening?
I came here about 20 years ago, and at the time I was working for a medical. So I said, who should I see? They said, well, this group is really good. So I got in, and they said, well, you want this doctor, but it took me 5 or 6 years to get in to see him. So I finally got in to see him, and he's very good. But through the years, every time we went to see him, he wouldn't listen. He just wouldn't listen to what I was trying to tell him. And
Deb, do you think that they were not listening because you were a woman?
I think so. I think it was because I was a woman and I was overweight, and I didn't like to think. I like to think I would rather take a supplement and do things healthy for my body as opposed to just taking pills all the time. And so we clashed a little bit there. But every time we went to him, my blood pressure was elevated. And I couldn't understand why. So there were 1 or 2 incidences where with medication I had a problem with them, and finally I just got fed up, and I came out and I prayed, and I was looking for a doctor. I said, well, maybe there's a female doctor that I could see, someone that would listen and that I could bond with better.
I'm going to ask you a question about when you mentioned the looking for alternative of therapy. I asked you if you think that being a woman made it more challenging to you to communicate with your provider. And in the past, in other moments, I have discussed that you had to select a partner in healthcare that listens to you. Know that if you don't feel that you're heard, even that doesn't necessarily mean that you're right. That doesn't necessarily make us right all the time, but you want to know that the person that is taking care of you, that you're trusting your health to, that they are listening, no? And that is so important. Even if at the end they correct you and said, no, Deb, this is not how it works. Sometimes it's just understanding, but somebody that is actually there. You mentioned that you pray for a female doctor. Why? Why a female doctor?
I just think females are more compassionate. I think they're more gentle when it comes to procedures or doing anything. I think they just understand a woman better.
I think that in general, we have the blessing to be mothers, and in a way, that alone make us be a little more caring for our patients, no? And we're caregivers, we're daughters, we have parents, so it's just a different nature. Of course, it doesn't. The gender of the provider should then be the reason why you don't have a good relationship with your doctor, because we should be open to have good relationship with our patients. So it can be a man that is caring, or it can be a woman that is caring. But I think that the message is they have to care.
They have to care. They have to listen.
Like when you were there expressing to them, I rather don't take medications. And I think that is actually very reasonable. No, if there is an alternative to medications, what would you recommend? Or can I try? They have to be willing to do that. After all, patients have autonomy. They can choose what they want and what they don't want. And we're here just to guide them. But if you find people in your journey that there's just authority and it's my way or no way, then is for the listeners out there that doesn't have to be like that. And, even though you present my presentation in your live in a very, I just picture the movie, like you coming out of the elevator and here I am. No, so
it's just the truth.
So you pray for it, and you're a woman of faith, and God put me on your path. But ideally, it should be that every woman find in their path that person that can care for them and that can be there for them. But besides me, you have other providers in your journey that they have been there for you as well. And do you want to share the story when you had your heart attack?
Whenever I had my heart attack, I had it at home. So the ambulance came and they picked me up and they were on. And I asked them, I said, "Do you think this is my heart?" And they said, "Oh no, you're way too young to have a heart attack."
Okay, way too young means how old were you then?
46. But
you didn't fit the profile,
right? But in my family, I had a lot of uncles die at 46. So, I mean, to me, it would fit right into my history. We got to the emergency room and they were still really not too concerned. Well, my family doctor met us there at the door to the little cubicle, and she started telling orders, telling this, and this, and sure enough, I was having a massive heart attack. And if it wouldn't have been for her, I often think, I wonder how long I would have laid there, before something might have been done.
And that is the sad truth. No, first, I think that the message of there's not age for heart disease. Yes, there are certain risk factors that are there, but we cannot be labeling people because they are too young or they look too young or they look too healthy. In your case, you were having symptoms that were not necessarily recognized by the people that were around you. And actually, can you share what were you experiencing how was your heart attack?
I had no symptoms before. I had been to the doctors just a few days before that. Everything was good. That day, I was really tired for some reason. And we had gone out to eat. We came home, and on the way home, I just started feeling nauseous, a little dizzy. Got out of the car, and I can't remember exactly. I had this strange feeling of doom, just doomy, gloomy, just a feeling that I've never had before. And I was about ready to lay down on the garage floor, and they were like, no, I have to go up into the house. So I went up into the house, and by that time, I just laid on the floor and said, call me an ambulance, because my left elbow hurt so bad, and it felt like I had an elephant on my chest. Just I just couldn't, I couldn't maneuver my upper body to take a breath.
So the initial symptoms that you started experiencing were more of the typical symptoms for women when I'm just fatigued, I don't feel right. I just don't feel right. Now, sometimes it's just as simple as that. But even though you were experiencing the typical symptom that a man will present to emergency room with, which is I'm having this heavy feeling on my chest. I feel like there's an elephant sitting on my chest with my left arm being involved, when normally is red flag, red flag, red flag. Like you set up alarms every time you hear that. They put you in that bed and didn't give you the priority that you needed, not even with the typical symptoms. Do you think that was because you were a woman?
I think so, because it was hard. Women, I mean, you're just, and my age, I was also a lot thinner than I am now. I didn't fit fit the bracket.
Exactly. So you were like that perfect example of I'm young, I look healthy, and I'm having symptoms, and people are like, let's look for anything else but heart problems. Yes. But then you did got that doctor that could recognize your symptoms and said, oh no, we got to make sure that she's taken care of. And it was a blessing for you as well.
It was a real blessing, because I never expected to see her there. I figured I would just take an emergency room doctor. And here she was. She just like popped right in.
Yeah. So your symptoms were not taken seriously. What would you tell our listeners if they encounter a similar situation like yours, where you have multiple examples now? What would you tell them when they feel that they're not being heard?
I would say, listen to your heart, first of all, and just find a different provider. If they're not listening to you and not paying attention to you, just find a different provider, because there's wonderful providers out there.
Exactly. So I love that. I love that you said that, because there's hope. No, so you don't have to settle for something that is not working out for you. And then, of course, we don't want our listener to think like, oh my God, this is a disaster. This system is just messed up. And what are we going to do if we ever have a heart problem and the doctor that is in front of us doesn't know? And you're saying, no, there's good doctors, there's good providers, there are providers that are going to be aligning with you, that they know that they will listen and that they will partner with you. And I think that's a great message of hope for them to seek care elsewhere. Why do you think that is so hard for people to look for second opinions?
I think it's just you're afraid that your first doctor might find out about it.
And what would that create?
I think it would provide tension, especially if you went back to the first doctor. I don't know. I've never gone back to my original doctor, so I don't know. But that was always in the back of my mind. But then it got to the point, like with your office, when I came for my first visit, my blood pressure was strictly normal. I met you and Shelby, and it's just like we'd known each other for a while. And, you were okay with me trying to enhance my health with supplements as opposed to medication. And that's very important to me. And I just like your attitude and Shelby's attitude that you're going to work with me and we're partners in my life. And you might want me on a medication, but right now I'm kind of not doing what you would recommend. How I say that? I'm not sure how I say that.
No, that's perfect, because I understand what you're trying to say. Okay, so I'm a cardiologist. I'm certified by the American College of Cardiology. I'm a fellow of the American College of Cardiology. So we abide by guidelines. We have plenty of guidelines in the cardiology world.
You have to follow them.
And then when a patient come to us and they come to us with certain conditions that we know they should be treated this way, then this is what I'm going to offer you. However, as I always tell all my patients, including you, I said, this is what I think is best for you. This is what we know is best for you. This is the data that we have collected that proves it. But it's your body. You have autonomy. And that is the part that I feel is a little hard for many providers to understand. We are partners in the healthcare, but we don't own your body. I can only facilitate for you. So if I am listening to you and you're resisting a recommendation that I'm giving you, it's my responsibility as your provider to try to understand from where is that resistance coming. Maybe you have a bad experience with another drug in the past, or somebody else in your family, or something that you read. So it's for me to understand from where is that resistance coming, clarify your doubts, give you the data, but at the end I have to respect that you have a patient autonomy is crucial. You have to be the one that decide, yes, I want it, no, I don't want it. And because you said, I'm not going to take that medication, then that doesn't mean that I had to discharge you from the practice. No, it's like, okay, so let's try to work with things around it.
Yeah.
But as long as you understand, like you clearly said, maybe I'm not doing everything that I need to do, but I choose that. And I think that that's actually very important for the listener, that if they are not feeling good with the therapy that they're receiving and they are trying to tell the doctors, I don't feel right with this and I don't think it's the right medication for me, and they're not being taken care of, or they're being insisted of taking the medication, then either seek for another opinion with somebody else. Now that I mentioned the opinion, I think that you're right in the sense that patients are afraid of seeking a second opinion because they are scared of what the initial provider is going to feel if they look for a second opinion. No, but I think that that's also part of. There's different ways that we can get second opinions. No, we have ways of doing it in a way anonymously. I do get patients in the clinic that they don't necessarily have to report to the initial provider that they're coming in for a second opinion. Like you, more often than not, they will not go back. No, but some of them will go back. But also we have as provider to be willing to allow our patient to go for second opinions, because otherwise we'll become that doctor from your childhood. Then we'll be God. Like, who are we? Who are we to think that we are that? No, so I think that as provider it's also important to recognize maybe I'm not seeing something, and it's okay to collaborate with somebody else that can help me understand or see something else. And I'm actually a firm believer of second opinions. I offer second opinions, but I also send my patients for second opinions. Granted, as humans, because we try to do our best to care for our patients, I will understand that maybe somebody feel like hurt with the fact that their patients feel that they want to hear this from somebody else. No, it's like, oh, they don't think that I'm doing a good job. No, sometimes it can be like that, but I think that we have to be realistic that there's so much to know. Like, how can you even think that you know it all? It's like, allow them to go for a second opinion. And I feel that if as a doctor, we can do a better job encouraging our patient to seek second opinions. So I was like, okay, this is based on my preparation, based on the knowledge that I have, based on what I know. This is what I'm recommending, but if you like a second opinion, I'll be happy to send you elsewhere. Yeah, and I think that opens the door. More often than not, you probably will trust your doctor and go for it. But if you don't, or you still have that hunch in your heart that I'm not sure about this, then your own doctor is opening that door for you for a second opinion. So I think that it would be great for the listener to be okay with it, and actually even check with their doctors. Let's say you're going to establish with somebody today and say, to meet the doctor and said, oh, would you be offended if I ever had to ask for a second opinion? And see what their reactions will be.
I never thought of that.
Even maybe we can even start a trend and said, okay, so question for my doctor, would you even be offended if I had to go for a second opinion? Because it's sad that we had to go in a secretive way to look for a second opinion, no? Would you feel more comfortable? Yes? Yes. Okay, so is there any message that you want, any other message that you want to share with our women that are listening to this podcast today?
Just to stand up for yourself and to keep looking until you find a provider that listens and will talk to you and you have a good rapport with.
Awesome. I am so grateful that you accepted the invitation to come here today, because your story is so relatable, and your story is the story of so many women out there that are sitting on waiting rooms, that are sitting on doctors' offices, even though they know that visit is probably not going to be very productive for them because they don't feel heard and they just following in somebody else's agenda. So I really thank you, Deb, for being here.
Thank you for having me.
Thank you. And this is the end of another I AMU episode. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.